This is a special report.
The week before that, I think we would have said, was a week that changed our lives profoundly, and next week will be even more so. We're dealing with something we've never dealt with before. None of us has experienced. We are all together trying to figure out how to deal with a new reality, and that will be something we grapple with together for weeks and months to come. Everyone, it's important to recognize the distance we've had to travel in very, very little time. We've had to get used to things that were literally unimaginable, and we didn't get months to get ready. We only had days to change our habits and our lives profoundly. Anyone out there who's confused, you are absolutely in the vast majority with the rest of us. We're all trying to make sense of so much new information, so many new challenges, and trying to figure out the right way to do this together. I'll be talking today about clearer, specific ideas about how we will work together within the new pause order from the state of New York. I'll be talking about the ways we're going to work together to get through the weeks and months ahead. I'm going to be very clear about challenges. I think my job is to tell you the things that we're going to confront, including some things that are difficult to hear, but to brace New Yorkers for the reality, to get you all informed honestly about what we're dealing with and what we will deal with, but also to remind you of our strengths, of all the help that people are giving each other, all the help our city government can and will give, our state government can and will give, all the people who are stepping forward, not only in New York City, but all over the country, all over the world, who want to help New York City right now, and God bless them all. I'll talk about all that today and in the days ahead. But really, it is important to recognize the sheer extent of change and to understand how challenging that is for all of us as human beings to make sense of so quickly. If anyone is feeling anxious or fearful, that is entirely normal at this moment. And what's so important is to talk it through with each other and seek, good and real and accurate information, which we will provide constantly, to support each other, listen to each other's concerns, see how we can help, particularly how we can help those in greatest need. And that's what New Yorkers do so well. We've seen it time and time again, after 9/11, after Sandy, so many times, when seniors needed help, folks with disabilities, folks who didn't have medicine, folks who couldn't get out of their apartment. Time and time again, everyday New Yorkers answered the call. And we're going to need that again. And we're going to be at this again for weeks and months. But I'll tell you something, I really believe that even though we are the epicenter of this crisis, and I want to be real honest about that, we are now in New York City the epicenter of this crisis in the United States of America. I am not happy to tell you that, and you're not happy to hear it. But I'll tell you something else. There is no place in the United States of America, no place on earth, where there are stronger, tougher, more resilient people, where there is more spirit and compassion. This is the place where people can handle anything thrown at them. That's who New Yorkers are. That's who all of you are. And that gives me a lot of hope. And I've been real honest about the fact that I'm not satisfied by our nation's response to this crisis. I don't feel that there's been anywhere near the response that any place in this nation deserves, especially our nation's largest city with 8.6 million people on the front line. But at the same time as I'm deeply concerned and troubled and angry and frustrated at the lack of federal response, I am inspired by the response right here in New York City from everyday New Yorkers, from our public servants, from all the people who protect us and keep us healthy. So many good people who are stepping up. And I'm inspired because I believe if there's one place on earth that has the ingenuity and the creativity and the sense of entrepreneurship to find a way to overcome this crisis with our own resources, that's right here. Now, I want to be 100% clear. That doesn't let the federal government off the hook in the least. I couldn't be angrier at the lack of response. I've been very plain about that. But you know what? If we're going to be left to fend for ourselves in New York City and New York State, well, I can at least say there are no people on earth who are more creative and more able to create something out of even the most tough circumstances. No one's better than New Yorkers. We're going to find a way to do things we've never done before. And I've likened this situation to war many times because it is. That's just the reality, and we've only begun down this very difficult path. But I already see New Yorkers doing extraordinary things. I already see people volunteering to find the supplies we need, to build the equipment we need, to make things happen, even when previously we would have thought it impossible. Isn't that the history of New York City in a nutshell? People making things happen even though they were told it was impossible. That is the story of New York and New Yorkers. So we will do it again in our time, right here, right now. Let me turn to some specific updates and information I want to share with everyone. And I want to take a moment to really commend the people who are doing exceptional work right now, helping us all. Of course, our healthcare workers, God bless them. They have such a tough job at this moment, but they are showing up with energy and passion, protecting the lives of so many people. Our first responders, we need them every day, every year, and we need them even more now, and they are at their posts doing their job brilliantly. Our transit workers, we're depending on them to make sure that everyone else we need gets where they need to go. And thank you to all the transit workers for what you're doing. And then there's a lot of even more unsung heroes who really deserve notice at this moment. You know what? Maybe in the normal course of life, you don't stop to think about the man or woman who works in the grocery store or the pharmacy, the postal worker who brings you every day things you depend on, and you're going to depend on even more now. All the delivery workers, whether they're in the public sector or the private sector, the men and women who deliver food and are now working at so many food establishments that are going through a tough time, but a lot of them are continuing to operate so they can help all of us. All those folks are answering the call in their own way. I want to thank all of you. We need all of you. And you don't get the praise you deserve normally, and you should get a whole lot of praise now because all of you are helping to keep this city running, keep it together, and ensuring the people who need help the most are getting it. So thank you from the bottom of my heart. I want to note, and I want to ask everyone, if you see, this is a time, I say it a lot, that, remember to thank people who do so much for us. This coming week, we're going to be dealing with a whole different reality. We've never been under this kind of order to pause our lives, change our ways. It's going to take getting used to it. It's going to take adjustments. There'll be some trial and error for sure, but let's thank the people who are helping us, helping to make it work. If you see a first responder, a police officer, a firefighter, a EMT, thank them. Thank the transit workers. Thank the healthcare workers. Thank those educators who are going to be at those enrichment centers, taking care of the children of those essential workers. And like I said, the postal worker on your block, the person who delivers a pizza to you, anybody you come across who's out there making it happen, please give them some extra gratitude because they deserve it. Each day, I have a very unfortunate obligation to tell you the overall situation in terms of the number of cases. I remind you, every case is a human being and a family, and the numbers, again, continue to be staggering. Confirmed New York City cases at this moment, this is based on information from 10 a.m. today, 9,654 cases, an unbelievable number. We couldn't even imagine such a number just a week ago. We are on the verge right now of 10,000 cases in this city. We essentially at this point, and this has been a trend over recent days, we represent shockingly about a third of the cases in the entire United States of America, and about 2/3 of the cases in the state of New York or even more. We'll constantly keep you updated, but I want people to just for a moment reflect on that fact. This is a crisis affecting our whole state, our whole nation, but it's a crisis affecting New York City far more than any place else, just by the numbers. 1/3 of the cases in the entire nation right here. We have lost 63 people to coronavirus in just a matter of weeks. We're going to constantly update you what we see within these facts to help people understand this disease better. And I remind you, it's a disease that literally no expert on earth fully understands, but we're trying to constantly confirm our understanding and update people. But here is a fact that's important. As of this moment in New York City, and this information will be published in more detail shortly, there have been, in the age group from birth to 44 years old, so New Yorkers from the first moments of life up to 44 years old, within that group there have been no deaths. And that is a very important fact, confirming a lot of what we understood previously about this virus. The breakdown by borough. Brooklyn is 2,857 cases, Queens 2,715, Manhattan 2,072, the Bronx 1,411, and Staten Island 593. Another very important point, and again, information will be updated constantly and made public when we can, but we've talked a lot, and I reflected a few days ago about a conversation I had with Dr. Anthony Fauci, who is the leading national expert in this crisis and who we all are turning to for important information. He's also a proud son of Brooklyn, proud son of New York City. He, days ago, said to me, we really need to educate people to the particular danger to those over 70 years old. Well, here's what we know in New York City so far. 35% of our hospitalizations related to coronavirus have been for New Yorkers who are over 70. 35%, over a third. But you should also know that people over 70 constitute only about 10% of the population of New York City. So what we're seeing is the over 70-year-olds represented among those hospitalized over 3 times more than their proportion of the population. That really reminds us that that's the particular thing we need to focus on. Folks who are much older, and particularly if they have those pre-existing conditions we've talked about so much. These are the folks in the greatest danger who we have to really move heaven and earth to protect, keeping them isolated and out of contact with other people to the maximum amount possible, supporting them, still giving them a lot of love and support, phone calls, FaceTime, everything you can do to support your older loved ones, getting them the things they need, but keeping them out of contact with others to the maximum extent possible to protect them. That's crucial. I'm going to talk for a moment about the situation with other levels of government, and it is ever there was a tale of two cities. This is it. The state of New York is doing so many wonderful things, so many of the right things to help people all over the state and certainly to help New York City. I commend Governor Cuomo and our legislative leaders in Albany, Speaker Hasty and Majority Leader Stewart Cousins, and so many people across the state government who are doing so much to help New York City right now. And on the federal side, it's almost exactly the opposite, where we're seeing so little. That is not to say there are not good people in the federal government trying to help us. And Dr. Fauci is a great example, and so many of the good men and women at FEMA are a great example. It's not one way or another, but when it comes to the decisions of government and the actions of government, really doing something tangible, we're seeing a lot of help from the state of New York and very little in the way of evidence that the federal government understands that our nation's largest city is in the crosshairs and that the federal government is going to actually do something about it. I won't dwell. I've been perfectly clear. We need our armed forces, and we need them now. And I'm very happy that we're getting the ship, the Comfort, coming to New York soon. That's very, very helpful. That's a great example of what our armed forces could do, but they could do so much more if they were fully mobilized, and we need them. We need supplies on a vast scale for this city. We are very happy that FEMA is here. That could make a difference, but so far we have no specifics on what supplies we will get when, and we need them now. I have, again, to compare, great appreciation for the announcement that Governor Cuomo made yesterday. 1 million more N95 masks coming to New York City soon. That's crucial. That's wonderful. But I have no such announcement from the President of the United States. In fact, he still has not fully utilized the Defense Production Act. He has not given orders to specific companies to not only produce those items that are needed most, starting with ventilators, but to ensure that they will be distributed to where the need is greatest here in New York and other key parts of the country. I believe that can't be done and won't be done unless and until our military is mobilized. And I don't know why on earth the president hesitates at this point. I think you're seeing a hue and cry all over the country for our armed forces to be activated. The time is now. Very quickly, and this has been put out publicly yesterday, I'll just give a brief overview. Number of personnel announcements. We are continuing to build out our team to deal with what is a wartime type of crisis. I want to thank for her extraordinary leadership my Chief of Staff, Emma Wolf. And I announced yesterday that I will add to her title the designation of Deputy Mayor for Administration, and that will put her second in the line of succession after our first Deputy Mayor, Dean Fullahan. Both of them have been the paramount, outstanding leaders of the day-to-day operations that are being run out of our Office of Emergency Management and other locations, coordinating all the work of all city agencies. We, all of us, even though we're working remotely from each other in many cases, we are talking constantly throughout the day. I am being given every hour, literally it seems, new decisions to make, and I'm determining the direction of the city's response. But I have extraordinary leaders to depend on to implement those decisions and to coordinate the work of all of our agencies. So a tremendous thank you to First Deputy Mayor Dean Fullahan and now Deputy Mayor for Administration and Chief of Staff Emma Wolf. I announced that we will have one of our most extraordinary public servants, our Sanitation Commissioner, Catherine Garcia, will take on an additional title as our COVID-19 Food Czar. This is a brand new concept, and it reflects the reality of what we're dealing with today. We hope to get good news from Washington of some kind of true stimulus package that will actually reach the people of this city and this country with substantial direct support, not token support, not one-time support, but deep ongoing support, so folks can afford everything in their lives. We don't have that yet, however. I'm desperately concerned that a lot of New Yorkers are running out of money, and that's the money they use to buy food, among other crucial necessities. Commissioner Garcia, in her new role, will create a citywide network to ensure that food is available to those who cannot afford it. Food is available to seniors and vulnerable folks. Food is available to people who were working just a few weeks ago and no longer have any means of support. It's going to take a mobilization such as we've never seen before. She'll work with all of those agencies that currently do food relief, the Human Resources Administration, the Mayor's Office of Food Policy, obviously, state agencies, food banks, soup kitchens, so many amazing nonprofit organizations. She'll work with all of them, but she's going to build something bigger and more comprehensive than we've ever seen in New York City, on the assumption that food will become much more of an issue going forward, and that many people will have a strain that they have not experienced previously because of huge disruptions in their own income. So I want to thank Commissioner Garcia for taking on that role. I've named Peter Hatch as our COVID-19 public-private partnership czar. He will work with private sector entities and philanthropic partners to create a brand new network of support. There are so many wonderful offers of help coming in. We have to build that into a truly organized, forceful effort to ensure that the maximum private and philanthropic help reaches those in greatest need and augments everything we're trying to do as a city. Peter Hatch served previously as as Chief of Staff to Deputy Mayor Raul Perea-Hense. He will take on this new role as the public-private partnership czar. Also coming back into city service, my senior advisor for years, Gabrielle Fialkoff, who played a crucial role activating many forms of support for the people of this city. She did an outstanding job over 5 years serving the people of the city. She's returning as a senior advisor. She will ensure that many of the organizations that previously she worked with to help in normal times will help even more now in these tough times. And replacing Peter Hatch in his role as Chief of Staff to the Deputy Mayor Raul Perea-Hense, Deputy Mayor for Health and Human Services, will be Julie Borough, who has worked in our intergovernmental affairs operation, and thank her for taking on that new role. Lastly, we're going to be doing something, and I'm announcing this now, something we have not had to do in our recent memory in this city, which is to organize production here in New York City for vitally needed supplies and equipment. The notion of this city being left in so many ways on its own to deal with this crisis is deeply painful, but we don't take it lying down. We're going to fight for all the resources and support we deserve and need. But in the meantime, I've named Carl Rodriguez, who is currently Chief of Staff to Deputy Mayor Vicky Bean, Deputy Mayor for Housing and Economic Development. Carl will additionally take on a role running our production capacity group. This will be leaders from different city agencies working with the private sector to determine to the maximum extent possible, quickly, tangibly, how we will produce ventilators right here in New York City, surgical masks, hospital surgical gowns, anything and everything that we need. This is in no way letting the federal government off the hook. But it does say that if we can effectively produce something in New York City, even if it is not exactly the ideal we would want, but it's still usable, we will produce it here. I want to thank Carl for taking on this role and all those who will be working with him. Quickly, I'll talk about some other items and then turn to our police commissioner who will give you an update. On the question of parks, I spoke earlier with Governor Cuomo. We are fully aligned. We understand that we have a big and different and new challenge on our hands. Folks who are going to be home in a way that literally doesn't happen any time of the year, not even in summer, to have so many people home at once, so many families and so many children looking for some opportunity to get out of their homes, at least for a small portion of the day. Here's how we're going to do it, and I'm going to describe what we're going to do in the first week, starting Monday and throughout this coming week. And then we're going to judge the results accordingly, and we might then make some very different plans. And again, one of the things I want to emphasize, every single day instructions can change based on new circumstances because we are dealing with something that we've never dealt with before. We're going to always try and give you clear and consistent information, but I'm also warning people it can change. If it changes for a reason, and we'll certainly explain why. So on the parks, we understand that under the governor's pause order, which I entirely agree with, we need to ensure that if people want a little exercise in their day, that they can do that the right way. It is absolutely normal and human to want to get outside, get a little bit of exercise, but I remind you, the pause is all about social distancing. It is all about protecting ourselves and our families and each other. When we say you can go out for some exercise, we're not saying you can linger. We're not saying you can make a day of it. We're saying go out, get a minimum amount of exercise, get what you need, and then get back indoors. Same with grocery shopping. Go get what you need, get back inside. Gotta go to the pharmacy, get what you need, get back inside. We will be enforcing this, but with understanding for the challenges that people are facing, for how new this is. And I'll talk about it, and then Commissioner Shea will talk about it. We'll enforce through education. We'll enforce through warnings. We'll enforce with having real conversations with people to help them understand what's going on. We're not going to be draconian. We're going to give people a chance to get used to this, but I guarantee you we will enforce this new reality. And I think the vast majority of New Yorkers will understand quickly and will act accordingly. So, folks will go to their parks. That's normal. You want to get outside for a little bit, you want to get some exercise, you want to go for a run, whatever it is, that's normal. You got to socially distance. You can't do it the way you used to. You can't play team sports at this point. It's going to be, unfortunately, quite a while before that's possible again. There's no more gatherings. There's no more events. There's no more big barbecues. All that is gone for now. It's not gone forever. It's gone certainly for weeks, probably for months. At some point, we'll be able to resume a more normal life. But for now, when you go to the park, you're going for your own exercise. Now, you might say, well, wait a minute, what if it's a parent going with their child and they live under the same roof? Of course, if you're already living with someone under the same roof or a couple that lives together, let's be clear, that's a different reality. People who live under the same roof and are already exposed to each other all day long, and this is something the governor and I explicitly discussed, they already have a different reality, and they don't need to distance from each other because they're already in constant contact with each other. So if a mom goes to the playground with her child, obviously she's already in constant contact with that child. That's different than if that child came in contact with a child from another family, or that mom came in contact with a mom from a different family. That's the problem. Let's be clear. Within the family, under one roof, that's one thing. But families mixing, people connecting who are not under the same roof, that's where we're going to see a spread of this disease that we can't have. That's where the social distancing rules come into effect, 6 feet apart. And we all want to be social, but we just can't the way we were. So you can go to the park, but only for a limited period of time. Families can stay together, but don't mix with other families. If you're going on your own, stay on your own, keep 6 feet apart from everyone else. Go, get your exercise, get home. In terms of playgrounds, this is a thorny issue, and I'm saying this as a parent. I used to take my kids to playgrounds around Prospect Park in Brooklyn constantly. I understand a lot about the culture of our playgrounds and the challenges that we deal with in normal times with all the kids who want to be on the playground. Here's what we're going to do for this next week. And I'm only saying this for this next week because we want to try it out. We're going to say to parents, look, here's the reality. If you're going to go on a playground, you have to take full responsibility for the situation. Full personal responsibility. Here are some of the realities. We cannot have overcrowding on a playground. If there are some people already on the playground, is starting to get so you can't keep 6 feet away from people who are not part of your family, don't go on the playground. If our police, our parks enforcement officers, or other enforcement agents see a playground that's starting to fill up, they're going to clear it out. If you go to the playground, you need to keep your children away from children who are not part of your family. That's your responsibility. We will always do our best with city enforcement, but we can't be everywhere, obviously. You have to take responsibility. If you don't feel you can do it, don't go to the playground. Some parents have said, will the playgrounds be cleaned and sanitized? The answer, just a real blunt New York City answer, is no. They never have been. They can't be in this situation. It would take a Herculean effort every 5 minutes, literally, that we simply can't do. If your kids go to the playground, you might want them to not be on certain types of equipment or any type of equipment. You might say, I don't want to go to the playground. I just want my kids to run around in an open area. You parents have to make that decision. Well, what we're going to do is have playgrounds open to the maximum extent possible, monitored and enforced, but parents have to make their own choices for this next week as to what they feel is appropriate. I'm trying to give you real, honest warnings. We'll put up signage. We'll constantly reiterate these rules, and we'll see how it goes for a week. If people are responsible about use of the playgrounds, and we believe it's a good outlet for kids who are only going to get a short period of exercise each day, we'll keep them open. If we feel that they're not being handled properly, if we feel that people are taking advantage in the wrong way of the situation or not paying attention to the rules, or it's creating something that's just not supportable, we'll have to, at that point, strongly consider shutting them down. It's not something I want to do. I really don't want to do that. I'm saying that as a parent. So we're going to see how this week goes. And we have agreement with the state of New York that that is the approach we'll take. Tomorrow, I'm going to provide the state with a written plan delineating what I've just told you in broad stroke, and we'll work with the state each step of the way going forward to determine how best to handle the real sense of reality of our parks and playgrounds. But again, NYPD is going to be out there. If they see anything that looks like even the beginning of a gathering, they're going to say break it up. They're going to say you got to get your quick exercise individually and get home. The message couldn't be clearer. And Commissioner Shea will give you a sense of what he's experienced in recent days. But I can summarize it. New Yorkers are listening. They are following the guidance they're getting. And when a police officer or other enforcement officer tells them to do something, overwhelmingly, they are doing it. They all understand what time it is. So I think we're going to see that we're going to find a way to make this work. Okay. Very quickly, let me just note, hold on one second. Oh, this is consistent with this point. To confirm just how much New Yorkers are adhering to rules, I want to give you an example. It's a very striking example for anyone who knows this town and has been here for any amount of your life, especially if you've been here a long time. I think you might find this striking. Yesterday in New York City, we sent out 4 agencies, NYPD, FDNY, Department of Buildings and Sheriff's Office, to continue doing enforcement at bars, restaurants, movie theaters, gyms, any place that we needed to ensure people were not congregating. There were 13,000 inspections yesterday by those agencies, 13,000 inspections, of which in only 11 instances was a violation given. 1 in 1,000, less than 1 in 1,000 cases was it even necessary to give a violation. I think that speaks volumes about what we are dealing with now. A very important topic. There's been a lot of concern about our jail system. I'm going to be giving you constant updates. This is an area of tremendous concern, obviously. Talked about an initial group of inmates who were being reviewed for release. This will be an ongoing situation and a rapid one. I have been working closely with the police commissioner and other officials, and obviously our correction leadership, to determine the proper approach that is humane and responsive to this crisis, but also constantly takes into account, I should say, public safety and obviously legal requirements. 23 inmates are being released today from our jail system. Those individuals are over 50 years old and low risk to reoffend. Some others, we're awaiting a response from the state before they can be released. We are now starting immediate work on a group of 200 additional inmates who are being reviewed for release. We will have the update on what number within those 200 will be released. That update will be tomorrow. These are primarily individuals who have limited time remaining on their sentences on Rikers Island. For all those who are concerned about this issue, I'm concerned, the police commissioner is concerned, the health commissioner is concerned, the correction commissioner is concerned. We're all trying to make sense of a very challenging situation in an appropriate way. We are looking at each individual case. And some of the portrayal of the situation, I think, has left out some of the complexity. There are individuals who I think are obvious candidates for appropriate release. There are some other individuals with complex histories that raise other questions. We're going to strike that balance, but we will continually update, continually look at tranche after tranche of inmates for potential release in this crisis. This next group of 200 we will have an answer on by tomorrow. There's a very rigorous effort being made right now in our jail system to keep everyone healthy and safe. There's a lot of resources being applied for the safety of our officers and inmates alike. That effort will continue to intensify. We have updates. I know some of them, I believe, have been announced about changes in testing locations. You can hear later on details from the health commissioner and from our health and hospitals CEO. There's been a closure of the site at Jacoby. We'll explain that when we get to Q&A. Everything is being done specifically related to prioritization. That means ensuring that we get to those individual patients in greatest need, and we do everything we can to use our testing capacity, ease the burden on emergency rooms. Testing has been fully focused on priority needs, structural needs to keep our health system going, to reach those in greatest danger. It will be tightly organized according to that principle, and we can get into detail in the Q&A. Few other points quickly. For our healthcare workers, these are the people, there's so many heroes in this city, and there's so many people we're depending on. I think we can all agree there is no group of New Yorkers we are depending on more right now than our doctors, our nurses, our lab techs. Every human being who works in our healthcare system is precious right now. These folks are doing heroic work. They're working exceedingly long hours. They are putting themselves at risk. We must support them in every way we can. A small but helpful thing we can do right now, in light of the profound changes in this city, the fact that so much of this city is not operating the way it normally does, and the idea of commuting has been fundamentally changed, and so many parts of our city are not seeing the kind of traffic, et cetera, that we're used to. We're going to do something temporarily in this crisis and grant parking permits to healthcare workers who we need to serve this city in this crisis. So there'll be a process to determine who qualifies, and we will begin with 10,000 permits for these heroic workers that we will start to distribute as early as tomorrow. Related to how people get around, there's an excellent question in the last day or two on what is essential in terms of how people deal with this crisis. And the question that was asked to me is, if car repair, mechanic shops, automotive shops are being kept open, shouldn't bike repair shops be kept open? I thought it was a very good question. We in the city have compared notes with the state, and we have agreement that yes, bike repair shops are essential at this time of crisis because more and more people are depending on their bicycles. So yes, we will instruct that bike repair shops will be treated as essential. And if they are open, all of our enforcement agents will know to respect that and allow them to keep doing their work that we all need. Finally, before I give you a few words in Spanish, just to say, I don't think anyone will be surprised to know that since we're in a crisis, we really have to be careful for everything we need, everything that's a basic need, and nothing is more basic when it comes to protecting people's health care than ensuring that there is a blood supply to serve all New Yorkers. Right now, our blood supply is sufficient, but a lot of the blood drives that happen throughout the year, particularly based in companies that we appreciate deeply, a lot of those have been canceled because the companies have had to shut down. Giving blood is essential, so we need New Yorkers to step forward. Go to any New York Blood Center site in the city. If you are going to give blood, everyone will know that that is an essential activity. Again, you go, you participate, every one of us says thank you, and then get back home, as with everything else. If you are ready and willing and able to give blood, please call 800-933-2566. Again, 800-933-2566, or go to www.nybc.org, nybc.org. Everyone, I've heard from so many New Yorkers who want to do something, who are looking to be helpful and, are frustrated by this crisis and want to help. Here is a way that anyone who qualifies can help. So we really, really appreciate that. In Spanish, comenzando esta noche, solo los negocios esenciales estarán abiertos en la ciudad de Nueva York. Les insistimos a todos, quédense en casa, a menos que tenga que salir por razón esencial, y protejan a los más vulnerables. Los meses que vienen van a ser difíciles, pero vamos a superar esta crisis, como siempre lo hacen los neoyorquinos. With that, I want to turn to our police commissioner. I want to thank you, Commissioner, and all the men and women of the NYPD for absolutely outstanding work in this crisis. And I know together we're going to be figuring out how to do some new things. But I know you are up to the task, as are the men and women who serve under your command. Commissioner Dermot Shea.
Thank you, Mr. Mayor. As the mayor said, it's been an interesting couple weeks here, but I can tell you definitively that the men and women of the New York City Police Department, as well as all the other city agencies, certainly the healthcare workers across the board, are rising to the challenge. And it's at a time like this when, quite frankly, you see the best in people come out. And we're seeing it day in and day out. The traditional crime that we put on the shoulders of the men and women of the New York City Police Department has not been forgotten, but there is so much more that they've picked up in the last couple of weeks. Just most recently, in the last couple of days, we've begun surveying over 500 large supermarkets in New York City. Just yesterday, in the last 24 hours, between pharmacies and supermarkets, over 1,600 visits by the men and women of the New York City Police Department, and literally no issues. A couple discussions about overcrowding, but overall very well. In the last 24 hours, over 5,500 bars and restaurants, and that's the story that you're continuing to see, cooperation by New Yorkers. 2 arrests out of 5,500, and that, I believe, is 1 incident in Queens. So by and large, we are seeing cooperation. We're seeing New Yorkers rise to the challenge throughout the city in all 5 boroughs. You're seeing tasks picked up by the men and women of the police department in reaching out to elderly people that may not be serviced by traditional means, and working with elected officials, working with community partners, getting them food. So I can tell you that I couldn't be more proud of what I've seen. To the parks, the mayor mentioned the parks, and in the last couple days, it's an interesting dynamic now as we get through this time where we've been all stressed, I think, and all pent up inside, and we are like no other city in the world. In a city of over 8 million people, a vertical city. And you saw yesterday people getting out, exercising, which is a good thing. I can tell you that I hit in the last 48 hours, the East River Park, the West Side Highway. I personally saw Riverside Park, Central Park. Over 99% of what I saw is what you hope to see. New Yorkers coming out, parents with kids, responsibly, getting the exercise that the mayor talked about. No, I did not see organized sports. The biggest thing I saw was a 2-on-2 pickup game. And I can tell you that the men and women now of the New York City Police Department are getting more and more involved in this, as the mayor said. I made calls yesterday with some of the borough and bureau commanders of the NYPD to just reinforce that messaging piece of this. We're all in this together. Reinforce that positive message. As much as you want to get out, there's a responsible way to do it. And that's what we all need to hear and take part in. So you'll expect to see police officers throughout the 5 boroughs, whether it's on a bicycle, probably on some scooters and some marked police cars, driving slowly through the parks and just broadcasting and speaking to people about that message. Enjoy, how you doing? Get your exercise, and then politely get out of here. And I say that tongue in cheek. We are all in this together, and it was heartwarming, I'm sure, to see. Mr. Mayor, you touched on it. People that are behind closed doors all day, every day. That's not really what we're worried about when they're walking. A husband and wife holding hands in the park, taking a walk with their dog. That's not really what we're worried about. They're together in the apartment anyway, but it's the large groups. I heard from some elected officials yesterday and throughout the city working on this. We gotta think long distance here. This is a long game. So those backyard parties, those DJs, I'm sorry, DJs, I know how everyone is hurting here, but we can't be having parties with large gatherings, whether it's in backyards or anywhere else in New York City at this time right now. It's just too dangerous. So thank you. I'm sure we'll have some questions, but again, on behalf of all the men and women of the police department, thank you for all the kind words. We are there for you, and we're going to continue to be there for you.
Thank you very, very much, Commissioner. I think you laid it out very, very clearly. I think you said a very nice version of "get out of here." I like that, and we'll make sure the message spreads in a very smart, fair, decent way. With that, want to make sure that we now have an opportunity to take questions from the media on all the things we talk about here and any other topics they would like to bring up. And let's turn to the media questions. Who's first?
Hi, all. Just a quick note at the top. We ask that everyone limit their questions to no more than 2, including follow-ups. This allows us to be fair and try to get to as many people as possible. We will start off today with Aaron from the Post.
Hi, good afternoon, Mr. Mayor. Can you hear me?
Yes, indeed.
Oh, so just wanted to circle back on the issue of parks and people going outdoors to get their exercise. And just wanted to see if there's any sort of understanding as far as what the cutoff would be, how much time is enough time, and also understanding that people have been pretty good about abiding by these rules as far as businesses goes, what the sort of potential enforcement or penalties might look like if you encountered anyone particularly obstinate.
I'll start, and I'm sure the commissioner has a view too. The first thing I want to say is the NYPD, every single day, and I would say this about parks enforcement, and depending on how this plays out, we could easily get other agencies involved as well. But the story that I think is missed, and I don't ever blame the media for telling the exceptional story or the dramatic story, but I would like us all to do a little bit more, particularly in a time of crisis, to acknowledge what is exceptional and dramatic and unusual versus what is typical. When you hear the number of inspections were made and you only had 11 violations, as I mentioned earlier, out of 13,000 inspections, that really says something not just about store owners, but about what people in general are understanding about this crisis. And I have seen it in many places I've been in recent days. I really think there's a deep understanding that something profound has changed and it has to be handled differently. And I have a lot of faith in New Yorkers. I have a lot of faith in everyday people. Will there be some individuals out of 8.6 million people who don't get it? Of course. And our officers, for time immemorial, have had to deal with people who don't get it, people who try and make their own rules, people who think they're smarter than anyone else. I assure you, there's no one more worldly wise than a New York City police officer. There's no one who understands the human condition better than a New York City police officer. And they are extraordinarily resourceful, our officers. So sometimes they use humor, sometimes they use firmness, sometimes they illustrate their point. Whatever it is, I've seen it throughout my life. They know how to talk to people. They know how to talk to young people and old people. They know how to talk to every kind of person. They'll make clear what you got to do, and I believe the vast, vast majority of New Yorkers will listen. We're not to the point yet of specific sanctions because we're starting down a road, and we'll decide with the state if we need to get into sanctions more deeply, but I don't think that's going to be the case. I think the number of people who truly don't get it and try and stand apart is going to be limited. And I affirm, if someone really wants to disagree with a police officer and acts in a manner that's inappropriate and illegal, well, then they will be handled the same way as anyone else who obstructs the work of a police officer. But I don't think we're even talking about the level we might see of that in normal times, because we're dealing with a crisis that's being felt in every inch of our city. I predict you're going to see a different reality and the word will spread. And I'll turn to the commissioner one more point. How much time? Well, we're going to work on this, and I think it would be helpful to give people some guidance. But I just want to start with common sense. How much time does it take to exercise? Folks who go for a jog in the morning know how long they go for a jog. People go for a bike ride know how long their bike ride is. People go for a walk know how long their walk is. You know what? If you're exercising now and you have a basic thing you do, for a lot of people I'd say it's a half hour, 45 minutes, something like that. Go get in your exercise and get home. Or go do your exercise, go to the store, get home. The point is maximize the get home part. Get only the most basic exercise. Understand you need to walk your dog, and then get home. Your kids, understand you have young kids that are going crazy inside. You need to get them outside for a while. Get them outside for a while. As soon as you get them through a little bit of, working off their steam, get them back home. So we'll give some guidelines, but this is also about personal responsibility. This is about common sense, which is what the vast majority of New Yorkers have. We're not going to allow gatherings. We're not going to allow loitering. We're not going to allow someone just to hang out and for a long period of time. If An officer sees you and you're sitting on a park bench, they're going to say, hey, you need to get home. The person says, oh, I'm only going to be here for a few minutes and I'm going home. Fine. If someone thinks they can hang around for a long period of time, I assure you that officer will remind them again energetically. But people just have to get it. We have to help ourselves and each other by taking seriously, just what you need, nothing more, and get home. Commissioner.
As I hear this discussion, I'm thinking, and I laugh at the reputation that we have as New Yorkers of running around, running from one location to the other, bumping past each other, probably like no other city. I've seen the opposite in the last 2 weeks, and I'm sure you have too, whether it's in parks or walking around. There's a forced politeness these days of allowing one to pass before you proceed down a path. That's what I saw in the parks yesterday, and not universally, but you saw people giving each other that wide berth. In 2 weeks, we've learned to distance, whether it may not always be 6 feet, it may be 3 to 4 feet, but you're seeing this all over. And I saw it yesterday in every park that I visited. Not universally, some issues. We will double down on the education piece. And this, I'll tell you, on a personal level, this hurts. The last thing you want to do is tell kids that are doing everything we want them to ordinarily, but not under these extreme circumstances, get out of a park. But we have to, we'll continue to educate. And again, I think the message here is you can find 3 or 10 or whatever it is messages on Twitter. I was out there myself and saw it firsthand. By and large, there were no large organized sports. There was people getting out on a beautiful day in a really difficult situation, and we'll continue to monitor it. We'll step up the presence as well as the audio messages and the speaking. And again, this is probably the least of my concerns.
I want to just build
Please,
on
Commissioner.
that. I just want to build on that to say, as the mayor mentioned, we want New Yorkers to use good judgment in terms of time, but I want them to pay special attention to ensuring distance. This is about distance. This is not so much about time as it is about distance. And the longer, given the density of our city, the longer someone stays outside, the greater the risk of coming in contact with someone within that 6 feet perimeter. And so that's why focus on distance, not so much on time.
Right. That's great, and I want to just put a point on that, and then we'll keep going. I think Commissioner Barbeau said something that's really good common sense guidance. Yeah, if you stay out longer, your chances of bumping into someone, your chances of being put in a situation that's not the ideal, which is 6 feet apart, those chances increase. Where do you know you're not going to bump into someone or end up coming in contact with someone else who, God forbid, may have the disease? At home, right? It's when you're at home, you know what you're dealing with. So you get the exercise you need, keep it as tight as you can in terms of time. You go to the store, even if you go to the store, keep your time as tight as possible, observe that 6 foot distancing. Soon as you're done, get back home, because that's the safe thing to do. And it's not going to be fun, it's not going to be easy, but it's also not going to be forever. And we want to keep people safe. Go ahead.
If I could just one more in that vein, Mr. Mayor. Governor Cuomo this morning floated the ideas of potentially opening up some streets, or I should say closing them to vehicular traffic and opening them up for people who want to get out, stretch their legs, get a little fresh air. Is that anything that's being considered? And thank you all for your time. I appreciate it.
Thank you, Aaron. I spoke to the governor about this, and we had a great conversation, and we're going to codify in the next 24 hours our approach here in New York City, share it with the state, with the governor's team, and we'll take it from there. But we had a high level of agreement in the conversation earlier today. We're certainly going to consider over time the possibility of opening up some streets for recreation, but I want to caution the first frame is the first frame here, which is we want people to get that exercise, get that time they need, but we also need to enforce it. And our ability to enforce directly correlates to knowing where we need to put our focus, our energy, and our officers. We know where that is right now in terms of our parks and playgrounds, because right now the NYPD patrols those areas, the Parks Enforcement patrols those areas. That is something that we can focus on, have a strategy for, and do the right way. If we're going to expand, we're going to expand very purposefully. If we're going to look to have a street that's opened up for recreation, we're going to do that very smartly and carefully, because we have to attach enforcement to it. It cannot be, oh, we're just going to close off some streets and leave it be. If we do that, I guarantee you what will happen is a whole lot of people start to congregate. And again, because we're humans, we're social, it's natural, and people won't remember, and they'll fall into. I see it all the time in the last few days. People start to reach out their hand to shake hands or start to want to hug someone they know, and they stop themselves, almost without exception. I find that sort of sudden stop. It's going to take us a long time to get used to it. So if your block, if you put barriers at the end of your block, everyone's going to come out and hang out like it's normal. We can't have that. We got to do this in a systematic, careful fashion. So that's an idea that's on the table. What I would say is, think of it this way. We're going to start with the parks and playgrounds we have that we know how to patrol, determine over the coming days if we need to expand that, and if so, how. But most importantly, how do we enforce it? How do we keep eyes on it? How do we make sure it works? So one stage at a time, and we will keep people updated as we do. Go ahead. Thank you.
Next, we have Alex from the Daily Beast.
Go ahead, Alex.
Hi. Hi, can you hear me?
Yep.
Okay, great. There's growing concern among a lot of gig economy workers, not delivery people, but freelancers in general. We've now passed a cycle of a single paycheck, and some people are out of money. If someone is entirely out of money, let's say, and that goes everywhere from rent to food, what actions should they be taking?
It's a very painful situation. I'm glad you raised it, Alex, because this is, I think the gig workers are facing some of the toughest dynamics here. Obviously, it depends on each individual. Anyone who, again, everyone's different. Everyone's a different situation. Anyone who does have the opportunity to apply for unemployment insurance obviously should. But we also know that system's overloaded. I'm not belittling that fact. We are hoping and praying that the Congress acts very quickly on a stimulus that is direct money into the pockets of working people, including gig economy workers. Obviously, there have been some other actions taken, which I'm happy about, including by the federal government, like limiting student loan repayments, and actions that have been taken by the city and state to ward off evictions. All of those things help. But we're going to have to do a lot more. And again, the place where we need help the most is the federal government, because the city is, really struggling right now to cover needs with what we have and with our own resources and our revenue that's clearly declining rapidly. So I think it is that stimulus bill. And then it's the things we're going to try and do that, God forbid, there's a gig worker who, as you said, hasn't gotten that paycheck, is starting to struggle to find food. That's exactly why Catherine Garcia has been named to this new position, to create a food network, a food distribution network, to help people who, honestly, maybe a few weeks ago, never in a million years would have thought of needing food and government support like that, but now they will. So at least with no evictions at this moment, hopefully people can pay the rent on time, but if they can't, they won't be evicted right now, and we're looking to find other ways to provide support and relief to ensure that people don't have money or not forced to pay rent that they just can't afford. Hopefully we can ensure there's a steady supply of food, and that will at least get us a fair amount along the way. And I remind people, in terms of health care, there's going to be people who won't be able to afford medicine. We're going to try and work on that issue too, but anyone who really is dealing with a serious health care issue, thank God for our public hospitals and clinics that will always back people up, regardless of ability to pay.
Thank you. And one more question. It's being reported right now that 2 dorms of 45 people incarcerated at Rikers are refusing to leave their dorms for work duties and meals in protest. And I'm just curious, is there a way that you guys could be possibly speeding up the release and relief of certain prisoners in our jail system.
Yeah, we are absolutely going to move very fast now. We had to work through some legal issues that were complex, issues, as I said, involving DAs and the state. We have a clearer template. We were working on this literally past midnight. I was here in City Hall after midnight, still on conference calls with people working this through because this stuff is very complex. But I am confident now that we have the ability to figure out what that right number is. I don't know the number yet. I want to be real with you and honest with you. And there are some people who clearly we are not going to feel comfortable releasing. But we will steadily increase the number to the point that we believe is appropriate. I cannot confirm the report that you just gave. I've heard that, but I have not heard it in a confirmed manner, so we will get that information clarified. But suffice it to say, over the next few days, those who can be released to the maximum extent possible, we're going to try and do that over the next few days. Go ahead.
Next up, we've got Amanda from Politico.
Go ahead, Amanda. Amanda?
Can you hear me okay?
Yep.
Hi, how are you?
Good.
I have a question for you and Dr. Katz. I was hoping you could circle back to the Jacoby.
Yes,
testing issue.
Dr. Katz is not in the room, but through the miracle of technology, I think he can hear us. Dr. Katz, can you hear us? Dr. Katz. Paging Dr. Katz.
He's on.
Is there Dr. Katz? He's on? He just can't, he can't respond to me, is that right? But he's talking on the line? Okay.
Amanda, we'll come back to you.
We'll be right back around.
Appreciate
Okay.
it. Thank you.
Who's next?
We have Ashley from the New York Times.
Go ahead, Ashley. Ashley?
afternoon.
There you go.
Yeah, I'm here. The question I want to ask is for the police commissioner about exposure, since officers are basically intensifying their role in the corona, in kind of making sure that everybody adheres to the rules. I'm wondering if you can give us raw numbers on people who are infected and out sick due to coronavirus inside the department, and tell us how, if and how the NYPD tracks exposure.
So, yeah, Ashley, at the beginning, I had a little trouble hearing you, but I think I got the whole thing. The most current numbers that I have, and they are moving, is 98 members of the NYPD have tested positive for corona. Of the 98, 70 are on the uniform side, 28 are from the civilian side. It's important to know that in terms of how they contracted it, you know, the belief at this time, with very limited information, obviously, is that it's not necessarily contracted at work. There's some are contracted sick family members. We are New York. So as society contracts this disease, and, you know, so do we. In terms of the testing, the numbers are going up because the testing on the entire city is going up, so that's not unexpected. In terms of sick rate, I'll stay away from exact numbers, but I can tell you that our normal, if you have a normal sick rate, and we do, for the department, it's approaching about double that rate, and we saw the numbers start to go up when this really took hold, roughly March 17th. I could tell you that we are still what I would consider in very good shape in terms of resources, but we plan for it literally every day. If I told you how many phone conferences I had in the last 24 hours, I'd be lying, because I literally, Terry Monahan is sick of hearing from me, Rodney Harrison, the entire executive staff.
Let's be clear. Terry Monahan is not sick. He's just sick of hearing.
Yes, that's correct. So we are not at the point where we're close to going to 12-hour tours. What we are doing, though, is planning for all eventualities and moving people from units that are less important right now to, you know, be ready for any all eventualities. So I think that we are in a good place still, and the planning is literally ongoing hour by hour.
The other thing I just, before Ashley follows on, I just want to say is, again, as we've heard from Dr. Barbeau, a typical younger, and this is, again, most PD officers, younger person,
Healthy.
20s, 30s, 40s, healthy person, their experience with this disease will be something like 7 to 10 days, and it will not be a fun 7 to 10 days, but at the end of that 7 to 10 days, they will be right back in uniform, right back at their post. So this is a number that goes up, but we'll have an element that starts to go right back down from that original group that got sick. A lot of them will come back online. We'll be going through this for weeks and months. I don't want any misimpression that a person who contracts coronavirus is, not coming back to work. They are coming back to work in the vast majority of cases, and soon. And we got to keep that in our calculations and in our planning. And obviously, we're very happy that most people are going to have a mild experience.
Yeah, I could tell you, Ashley, and if I miss one point, I'll circle back to you at the end. I could tell you that we've had people come back to work that had been put on quarantine, and I am really looking forward to when those people that are out sick with this virus come back to work for the obvious reasons. But I think, again, we're in good shape. Of the now 98, I think there's 3 that remain hospitalized. And that's including one that was discharged today, so that brings it to 3, and that's with pneumonia-like symptoms. I think I mentioned that the other day. So the vast majority, 95 of 98, are recovering at home.
But for those officers who've had contacts with the public, is the NYPD tracking that, and are you telling members of the public that they've had contact with an officer who has now been confirmed to have COVID?
You're talking post?
Post come once the officer tests positive. Are you going back and telling members of the public who they've interacted with in the course of doing their job that they have interacted with them?
Yeah,
do you have numbers on that?
No, I don't, and we'll take a look at that with legal. Obviously, you run into some HIPAA issues and things of that nature.
I go beyond it, and I'll pass to the Commissioner. I think we are at such an advanced stage in this crisis. But for a very particular situation where we thought, where our health people thought it was important to do that follow-through, I think the honest truth, Ashley, is we're in a new reality here where that generally is not going to be doable, nor is it necessarily going to make much sense. And I think the Commissioner is going to follow this on because of the sheer spread that we're experiencing overall.
Right. As I've been saying for the past couple of days, which feels like the past couple of weeks,
Sure does.
We do have widespread community transmission. So that means that it's very likely that a large number of people are already exposed, and there is no real way to track down back to the point source. The other thing I want to just emphasize is that even though we are learning more and more about how this virus is transmitted, we still don't think that just casual contact, passing someone in the street, is going to infect folks, right? We're asking people to remain 6 feet apart because that's the general distance that a good, healthy, strong cough or sneeze has to get from one person to the other. And so I just want to remind us of the basics, and it's not just passing someone in the street. It's not even limited contact. It goes back to those basics. And so while the tendency may be to want to let everybody know who it is that they may have contact with, that may have had contact with yet another contact, that kind of becomes irrelevant when we've got widespread community transmission. And that's why I have been so, dare I say, militant about having New Yorkers stay indoors.
Amen. Okay, who's up?
Dr. Katz's issues have been resolved. Dr. Katz, can you hear us?
Yeah, sorry, I could hear you always, but I had a technical problem.
All right.
Thanks so much for the question. With Jacoby, we switched...
Wait, is Amanda, hold on, is Amanda back on the line? I'm sorry, Dr. Katz, is Amanda back?
Yes.
Okay. Yes?
Amanda, we changed the method of testing from more of a walk-by or drive-by model at Jacoby. It will reopen tomorrow to relieve the emergency department, which is consistent with what the mayor says, that we need to focus our testing on those people who are most sick and help to decompress the emergency rooms where people are coming with mild symptoms. We need to focus our attention on those people who are sickest.
Dr. Katz, I'm hoping you're feeling okay and getting some sleep. Or is this transition going to happen across all health and hospitals facilities, or are we starting at Jacoby? Only? What's
Thank
the
you,
situation?
Amanda. All of our hospitals will have a tent outside as a way to decompress our emergency rooms. Several of them already have it. I visited the tent that was at Elmhurst and the tent that was already at Lincoln. Jacoby had the other model, and that's changing to the tent outside of the emergency room for this week coming.
Okay, great. Thank you very much.
Thank you.
Thank you. We have Craig from the Post.
How are you today? The unions have been calling for additional testing for fire, EMS, and NYPD. I was wondering, since these are the guys on the front line, they're going and they're getting people out of parks, is there going to be any plan to maybe do expedited testing for them if they're concerned that they have coronavirus, since they're out in the streets?
I'll start, and my colleagues will join in. Again, the entire testing system is based on the priority needs. There's a priority given, of course, to protecting our healthcare workers and our first responders, but that's done still according to the healthcare priorities overall. If someone is young and healthy and has symptoms, there's many, many cases where they're just going to ride it out and they're going to be well and they're going to come back. If after those 3 or 4 days we're not seeing them get better, that's a different discussion. But it's about a priority structure that we have to remember that the testing has to be there to protect the people in greatest danger. You want to speak to that, Commissioner?
Certainly. I think to the extent that they fall into the prioritization categories of being over 50, having one of the chronic underlying illnesses, being sick, not getting better, and having their doctor determine that knowing the test status is going to change the course of therapy, then of course we would want to test them. But the basic message of if you're sick, stay home for at least 7 days since your symptom onset, or 3 days after your fever has gone away, whichever is longer, will continue to apply.
Okay. Who's next?
Next, we have Katie.
Hi,
Who's
can
that?
you hear
I'm
me?
sorry. Who is it?
Mayor, can you hear me, Mayor?
Yep. Go ahead, Katie. How you doing?
I'm great. How are you? I'm calling to ask if the city's discussed if there might be any changes to property taxes, which are due in April.